Okay, I suggest that we are ready to go. I will do a quick sound check with my colleagues Dilhara and Tamara, who I thank for setting this up, together with Jin, of course. Can you hear and see me okay?
Clear. Yes.
Absolutely wonderful. Okay. Welcome. My name is Holger Schünemann. I work at McMaster University in beautiful Hamilton, Ontario, Canada. Background is our campus. And welcome to the first of a series of webinars that are sponsored by GIN, the Guidelines International Network, on recommendation mapping. And this first webinar is going to inform you about what recommendation mapping in general, but the eCOVID RecMap specifically is, how we developed it, and how it can be utilized. And we'll proceed with my declaration of the conflicts in just a second, but if you're interested in the eCOVID RecMap after this webinar, or already now, you can follow it on Twitter, obviously, at the link below. And I'm speaking on behalf of the eCOVID collaborators, and I will say a bit more about that. So as disclosures, I don't have any direct financial conflicts of interest. I'm co-chair of the GREAT Working Group. I will mention GREAT a few times. I will mention the Guidelines International Network a few times, for which I'm on the board and current vice chair. Cochrane, I will mention I'm the director of Cochrane Canada. We'll have some work that I will be specifically mentioning, but I want to acknowledge our principal funder for this work, which is the Canadian government, the Canadian Institutes of Health Research. The views that I will express here, however, are my own. And again, I want to acknowledge in particular Tamara Lotfi, who is here, who is coordinating this big enterprise, and of course, all my other colleagues. The objectives for today, I already mentioned them briefly in the intro slide, is to inform you about the eCOVID-19 recommendation map and how to use it. I wanted to say a few other things. One is that you can use the chat and chat with us. Some of my colleagues are on, obviously, who can answer any questions if you have questions right away. And of course, there's a few other investigators. I see Joseph and the two Josephs on, who are very closely involved with this work, and I'm sure they will also be happy to answer any questions if you have any as they come up. And I will then go ahead and really get started. So we started this work in the context of another disease. And what happened was that we were working with WHO and realized that recommendations and guidelines that are developed by WHO, here particularly the Global TB Department, are found in many different documents, very many different sources on the internet, etc. So there would have been a lot of different guidelines that were produced according to obviously standards of WHO. And we realized in working with the Global TB Department that there was a need to bring things together in a way that it would be easily accessible by those who use guidelines around the globe. There was a big question around the accessibility of guidelines and coordination of that accessibility. So together with a group of investigators, we worked with the Global TB Department. This is from a paper from Anissa Hazadeh, who was a graduate student with, and we developed this concept of recommendation mapping, which is really meant to be a tool to organize recommendations from different guidelines on a specific health condition and report features around the evidence and judgments that actually inform a recommendation. And then think about clusters and gaps in the availability of recommendations and then digitally present that. It's a concept that comes from evidence mapping, obviously, and the recommendation mapping in general is the result of applying the approach to one health topic that obviously starts with clarifying the scope of the particular guideline, cataloging questions, linking to evidence, describing certainty of the evidence that obviously should be included in a recommendation, then the visualization, maintenance, and facilitating use of the recommendation. So, and the main reasons was, just to reiterate, that was some enhancing accessibility of recommendations, the searchability of recommendations. You can just imagine, showed you the PDF copies there. You can just imagine that guidelines from a big organization are often all over the place. So making it searchable and develop a user-friendly platform that can be kept up to date. And then obviously the idea was that this would help in the consolidation of recommendations. So big organizations often have overlapping recommendations on similar topics, and that it would ease prioritization by identifying possible gaps and clusters, and that it would promote use. We published this work then on the guideline recommendation mapping in the Journal of Clinical Epidemiology, describing the efforts with the global TB department. And this is how this looked. So a web platform, we called it, or it is called the ETB guidelines at WHO. Here's the hyperlink, or the URL rather, if you'd prefer to, if you care to look for that. And the idea was really that we would provide a single online platform that would cover a topic, in this case, tuberculosis in general. We developed that concept by presenting two main views. One is what we call the recommendation map, and the other is a listing of recommendations. The principal functions are that there's a search bar and that there are filters that you basically see here. So in general, the recommendation mapping presents an x-axis and a y-axis, and the x-axis are typically the type of topics that are being covered. I'll explain that in more detail. And in TB, often the population or setting then was on the y-axis here. And what you see here is the different topics and the number of recommendations. You will see how that actually works in a little bit. Then there is a listing of recommendations here by topic that can be utilized and expanded. And then, as I will show you later, all of that is supported by details. So background information that leads, for instance, to a specific recommendation. Here in this case, this is about prevention of TB through systems interventions or healthcare facility system interventions, such as using UV light and other types of methods to prevent the spread of TB, with the recommendation strength and the certainty of the evidence. And all of that can then be accessed. I will show that more for our current examples. And all of that is searchable. So for instance, in this guidelines, you would search for chest x-rays, a recommendation such as that would be coming up. And in the TB work, again, this is the list view. We ordered this by topic. You see filters here. So for instance, what type of guideline, publication year, the age of the population that could be accessed in this particular way. We also created something like a heat map, where then the number of recommendations is highlighted, the number of recommendations per topic, and this then can inform about potential gaps in a topic. So one might want to ask, why is there nothing on screening for drug-resistant TB, or screening in healthcare facilities? Again, this is just an example. I'm not saying that these are relevant topics, but it's a potential potentially a potential use of that heat map. All of that is expendable. So for instance, under treatment, there will be many different treatments for TB that then are again reflected here in this overview, in this heat map. And finally, just to reiterate that each of the recommendations, and this will become a little bit clearer when I move to our eCOVID RecMap, each of these recommendations are supported by detailed information about the population, for instance, the intervention that is recommended or not recommended, as well as some details of where everything is coming from. So in other words, peeling off the layers of the onion in order to get to the detailed information. This was background to our work. We had done this work, started this work actually before the COVID-19 pandemic came or started. And so in order to support this background work, which was a lot of development, concepts, conceptualization, talking to people, trying things out, what we then did was we actually started a randomized trial of comparing this new way of accessing information, which is was also led by one of our grad students, Michaela Matthews. Started a randomized trial comparing this type of presentation to a just the typical presentation that we had. So intervention was the ETB RecMap, and the comparison was the actual regular access to the recommendations that in this case the WHO Global TB Department provided, and people were randomized in electronic surveys and recruitment strategies to the two different types of presentation formats. And this work is currently submitted, but we ended up randomizing 260 participants. A large proportion of those were from lower middle income countries. And in brief, the results were that the ETB map was more accessible and that the information on the ETB map was better understandable than putting it into a PDF format and just putting it on the web. And this is essentially our study design. I will not talk more about this for the time being. And then we expanded this concept to other groups. So this is on the Canadian the Canadian Agency for Drugs and Technology in Health that took up this concept of mapping recommendations for TB. So we did all this work, and then came COVID-19. And luckily, we were relatively prepared. There were calls for applications to help fight the pandemic. This is going back to April 2020. And we were pretty well positioned because we had started thinking about the RecMap in the context of COVID-19 as guidelines were emerging. And it started a collaboration with the Norwegian Institute of Public Health in that context, and said, okay, we need a COVID-19 recommendation map. And the goal really was, it was a very broad scope. The goal was to map and appraise all COVID-19 recommendations, and then understanding that COVID-19 recommendations would be developed globally and that there were limited resources and time was pressing, we thought, okay, we need to make sure that we utilize this RecMap in a way that it serves the community globally best, and thought of ways of how we can facilitate the adaptation of recommendations of users to their context. So this was funded by CRHR, as I already indicated, and we were able to put together in a relatively short time a global network of collaborators that have done a tremendous amount of work in putting all of this together. We act as a team. We have weekly meetings with a large executive, and these are the groups and the organizations that are represented. We are really I'm proud to say that we are working with partners on all inhabited continents. These are just some examples of the key groups that were involved from the beginning. So we are 57 researchers on the team that really do a lot of work that I will explain in a little bit more in just a minute. So, and I should have said that this presentation is recorded. I know there were a couple of questions in the chat, but this presentation is recorded and will be made available through Jim. So the goal then was here a bit broader and a bit different from what we had done in TB, although the concepts were similar that we wanted to apply. The purpose of the eCOVID-19 Living Recommendations Map was to provide decision makers and other stakeholders, including the public, with an easy to navigate, living, freely accessible electronic platform that would include all available trustworthy COVID-19 recommendations, and that would allow for easy contextualization. And the idea was to identify COVID-19 recommendations, critically appraise them, in this case with the AGREE instrument, and then make them available for contextualization and support implementation by decision makers across the globe. And again, as I said, when we set out, we applied to CHR, and there was a very short turnaround time for the reviews of applications. This was at that time a national call, and we're able to build on our WHO global TB recommendation work with that international team that we put together. So how does this work? So first of all, I'll go into more depth, but first of all, we search for guidelines, and this is just the sources here before I go a little bit more into the methods. But essentially, we search bibliographic databases on a daily basis. So Ovid, through Ovid, we search PubMed. These are, we use pre-filtered search terms that have been developed by the Health Information Research Unit at McMaster University, which is as many of you know, a well-known entity in this field of federated searches. We search the gray literature by monthly, some key organizations that are mentioned here. And then we do, for instance, web scraping, so in other words, some website searching of some key guidelines, the PAHO BIG, which includes all grade guidelines database, is being searched, NICE, WHO, and the GIN library currently. We obviously also rely on personal contacts, such as guideline developers and researchers. And for now, this is living through June 2022. And hopefully, given that the pandemic is not quite over and that there will be topics such as long COVID or post-COVID, depending on how the terminology will develop, there will be ongoing important work that needs to be done. And again, then we have started some new areas, and that relates to translation. So we're working on French translations, for instance, and we're working with groups such as Cochrane Task Exchange to develop something that we call plain language recommendations that I will talk about a little bit more. But this is how this worked. This is from a paper published by Tamara as the first author. So we, first of all, we look at all clinical public health and health policy guidelines on COVID-19. This is through the type of searching that I have described, that includes electronic and manual screening. Then this information gets inputted through a customized GradePro module. So the GradePro application software, grade software, has been modified to actually extract information, then directly loaded up into that website that I will show you. The same is true for the global TB, WHO global TB recommendations that goes through the GradePro platform. Recommendations or guidelines are assessed using the AGREE2 instrument. We are focusing on 3 domains that have to do with credibility, really, in this assessment, but eventually all guidelines are assessed using the 6 AGREE domains. that information is abstracted, it's coded, and it's put into evidence to decision tables and evidence profiles as much as possible. There's some links with these platforms here, including the Love platform. And then this information is being put into our recommendation map that I will show you. There's a number of stakeholders involved that provide feedback, and we've tried to do quality improvement in order to present the information in a way that is actually useful. We allow contextualization, particularly we support the great development approach, and there will be a follow-up webinar a little bit later. I will also speak to it a little bit more in order to make sure that decision-making is evidence-informed. So with all of these partners, we did that, and this is our tool that we've developed. This is a screenshot. This is the URL, covid19.recmap.org, and essentially the entry portal allows you to search for recommendations. So for instance, if you were to search for vaccination, you would get to the list view here. And that list view would list all recommendations that have to do with vaccination. And we have developed a number of filters that can be utilized in order to trim down the searches. So for instance, if you were to look for specific sources, all WHO guidelines, you would be able to look for all WHO guidelines. We have a filter for the publication year, for the region of the world, age groups, coexisting conditions, whether or not, and I'll get back to that, plain language recommendations are available. I'll talk about the recommendation type, and you can filter this information by recommendations that cover or that surpass a certain agree score. So agree score is using the suggested cutoffs for what constitutes a good score. So just as an example, if you were in Europe and you were interested in the ECDC recommendations, you could filter this information there. Same as for the TB RecMap, we have produced a heat map here. Again, if you were to look at this particular information, let's just say you were interested in treatment and rehabilitation, you could look at that by particular topic, and you would also see that there's obviously lots of information on treatment here. And again, this can be filtered as you wish. And then same principle, you can expand. So for instance, on vaccination, if you were interested in particular aspects, in particular vaccines, then this heat map would allow you to pre-filter that. So that is for now the intro, and in order to break this up a little bit, I wanted to I'm gonna do a little poll here. That way everybody who is on this webinar is not only listening, but you can provide some input. I'm just going to launch the first poll, and that is whether, in your view, what other conditions or diseases would lend themselves to recommendation mapping, and what could it be best applied to? And you can just put a short answer here, take a deep breath, and yeah. And so just can put a few answers in here. So the idea is, look at your polls. You should all have the polls available. I see a few answers coming in. So there's 10 answers, and that may already be enough to go through. And please, 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 yeah, look at the chat. Joseph, thank you so much for providing the relevant answers. There's some really important things mentioned, such as we have historical recommendations, we have the adapted recommendations. We are replacing recommendations as they may be outdated. So that's quite important, right, to understand what's happening there. Yeah. So we'll continue. I'll end the poll, and we have a few suggestions I'm going to share. There's actually quite a few people who participated. Let me just make sure here. I should be sharing the results. All right, so I will ask Tamara perhaps to pull them up. I can see them right now, but I know that many of you have provided answers. So that should be, I'm sharing it right now. So maybe Tamara, you can help me with I'm trying to make sure that we are there. We go. Thank you so much. Dilhara is actually doing this. Dilhara, if you could, I will paste that into the poll for everybody. That way everybody can see it. So great. This is super helpful. So people are coming and saying IBD, preterm birth prevention, Legionella, so quite a few very interesting, quite a few infectious diseases here. You could do screening in general, flu, of course, yeah. Diseases that where recommendations don't change much over time, diabetes, cardiovascular, chronic pain, COPD. COPD is great. It's a personal area of interest of mine, and various cancers. Yeah, those are great ideas on this particular topic. Yeah, superb. Okay, good. So then I have another quick question for you. So you're looking at this heat map here. The heat map basically showing how many recommendations there are per topic. And per a specific topic, I showed you that for TB. My next question for you is, if you think of this heat map, which again, we have thought of as showing clusters, showing possible gaps, just very quickly, any other functions or purposes that you could imagine related to this heat map that also includes, is that even sensible? Does a gap indicate that there is a lack of recommendations, or might it just be a function of having produced that type of map? So I'm showing this here on screen. Again, this is for vaccination, different types of vaccines, and you see here a few different conditions. They are not necessarily mutually exclusive. I'm just going to give it a couple of minutes, and then we'll continue. Yeah. And I'll tell you a little bit more about the map. And I'm supposed to share my screen, I think. That would be helpful. That way you know exactly what I'm talking about in terms of the heat map. There we go. So a few answers are coming in. Okay, that's great. There we go. So, and we don't need much to move on. I see 5 answers. That's already pretty good. Actually 6. And I will ask Dilhara if you could do the same thing, if you could just copy and paste them over. Thanks so much for your help. And you can just put it out to everybody in the group, and then we'll see what ideas people come up with as the community is embracing this concept. So the type of recommendations, great, formal, in a different color, combining the heat map with the date of publication to get a real-time scale of the recommendations, great, strength of recommendation or certainty of evidence. So few ideas around that, great. Thanks so much for that input. I think these are all things that I hadn't thought of, and that could be particularly helpful. Okay, good. I'm going to continue. So I'm going to continue with a few findings. So when we set out to do this work, it was obviously to a large degree a KT AKT effort, right? So we wanted to make sure that people had access to COVID-19 recommendations. And that was one of the reasons why the Canadian government funded us. But at the same time, the Canadian Institute of Health Research funds research. So we set out to also explore issues around guideline development, particularly in this pandemic, and then develop models and understand better how recommendations are developed in the context of a pandemic. So with emergency or urgency in people's mind. That was one thing. The other big thing that we realized over time was that, in particular in the context of the pandemic, there was lots of recommendations offered by lots of organizations. And interestingly enough, many of these recommendations were what we called informal recommendations. And these were just statements that a group made, an organization made, that were not necessarily following the type of processes that we would like to see. We list those recommendations under additional guidance, and I will show that a little bit later, but we list it under additional guidance. And these are typically actionable statements that are not based on a structured or systematic process. At least in our evaluation of every single recommendation that is out there in a guideline, we could not tell if a structured and systematic process was used. Obviously, these type of recommendations will end up with lower agree scores. We also identified and separated what we call good practice statements. These are actual actionable statements that that are needed, but do not necessarily follow a as formal process as a typical recommendation. There's a few criteria. Many of you will be familiar with that. Few criteria that the Great Working Group has put forward for the actual development of good practice statements. And we published, based on these findings, a taxonomy and framework for identifying and developing actionable statements and guidelines, and in particular, tried to provide guidance for how to avoid what we call informal recommendations. And this is supported by many organizations, or at least by members of many organizations that these authors are affiliated with, and has made it into guideline handbooks now, and will make it into more guideline handbooks. And so the experience with these COVID-19 guidelines actually then led us to really separate out in this taxonomy and framework, or expand on work that existed to provide information, definitions, and guiding principles for what are formal recommendations, what are good practice statements, what are informal recommendations, how this is separate from what is attached to a recommendation often, which are implementation considerations, tools, and tips. So for instance, in order to implement this recommendation, you need to provide learning material, or things about how to technically implement a particular intervention. So those would be implementation considerations, tools, and tips. And then research recommendations, and define that a bit better compared to what was there before. And then the other big finding that we had was that all of the recommendations, or most of the recommendations that we actually had identified, were quite difficult to understand. And very few recommendations actually included plain language recommendations. And I'll get back to that as well in just a little bit. So pretty much up until now, this is already slightly outdated. So the numbers are actually larger now. But I already mentioned who was involved. We have website visits from over 160 countries in the world. We've delivered many presentations and have tried to disseminate the information about the RecMap, which is free to use and free to utilize for your own guideline efforts. and have published now quite widely, but there's over 4,000 recommendations that are on the RecMap, from over by now 300 guidelines that are, again, if they are updated, either taken down or the updated recommendations are provided. And we've screened over 4,700 citations. And that just tells you how many guidelines have been produced in this very short period of time. Let me go back to the RecMap a little bit. So there's more information on the RecMap, and this is now focusing on how to use it a little bit. So, so if you were, for instance, searching for a recommendation about whether or not people who are symptomatic should be using home oxygen monitoring, so oximetry, then a recommendation, if you were to search for that from WHO, would look as follows: for symptomatic patients with COVID-19 and risk factors for progression to severe disease who are not hospitalized, WHO suggests the use of pulse oximetry monitoring at home as part of a package of care, including patient and provider education and appropriate follow-up. That is a conditional recommendation. The evidence was judged as being of very low certainty. And what we would do is on this website, on our tool portal, we would have these descriptors here of the population and the intervention, but we also have links to more detailed information. As I already said, I mentioned the onion metaphor, which is actually pretty good in this particular context. You can go and look for background information and details. So for instance, you could look for what we call the ETDs. Many of you will be familiar with them, the evidence to decision frameworks. This is based on work that the Great Working Group did from 2011 to 2015, the evidence to decision criteria and evidence to decision frameworks that were developed. But essentially what we either extract from the raw text or from groups that actually use the ETD frameworks are the information that belong into the various categories of the, or criteria of the ETD framework. So if you click on the ETD framework and the information is available, you would see the following: details about the question, the priority of the problem, desirable health effects. You would see a summary of findings table or evidence profile, if that is available for a particular recommendation, what the guideline developer thought about the values and how they judged the balance of the effects, for instance. Again, for some of the recommendations, this is a different example from a guideline that we were actually involved with, dealing with some prevention of venous thromboembolism, and taken up in this database. It's from the American Society of Hematology. Here you would see that there's a few things that you could do. Again, just focusing on the agree score. This happened to have a very high agree score in all of the domains. These agree scores are developed by two people independently judging the guidelines and checking. We also check back with the original guideline developer to not make them upset in case that we miss important information, and because they may just have supplemental information hidden somewhere else. So we do a quite detailed effort in contacting all of the groups that we actually, all of the organizations that we actually extract recommendations from. But what you could do, for instance, if available, you could also link to an interactive summary of findings table. Many of you will be familiar with the interactive summary of findings tables, which essentially are ways of presenting information to make it better understandable to consumers, such as through graphical presentation and different types of wording that facilitates information. So here you can enlarge outcomes that might be of relevance, in this particular case for DVT prevention and all other outcomes that are important in that context. So that's when ISOs are available. I want to spend a little bit more time telling you what is coming in terms of our webinar series and provide a little bit of background. You have seen that we focus this work on making recommendations available globally. We really want to support those who have limited resources or there's limited time in their adaptation of particular recommendations. We obviously use the development approach, the great development approach for that, but I'll give you a couple of examples. So there's a few adaptations that have already been undertaken. South Africa, for instance, the ASH guidelines were used as a base for some of the recommendations that were made on the use of heparin. In Brazil, the national recommendations for management of COVID-19 hospitalized patients were based on the RecMap or utilized the RecMap. 3 recommendations were adopted as is, 10 required adaptation, and then there were 2 new recommendations that were not previously covered on the RecMap, and that was based on information that could be utilized from the original guideline. And then we will have a webinar on this particular topic. So this is a bit of a teaser about that. Miroslav Kluga and colleagues will talk about adaptation, development. They have done a massive and important effort in the Czech Republic, using the map to identify and adapt 50 recommendations on the diagnosis and management of COVID. That webinar will be interesting to hear how not only use the RecMap for adaptation, but probably about development and recommendations in general. And then very specifically, we, as an example, one of the recommendations that was made by the Public Health Agency of Canada was adapted by the Canadian Rheumatology Association to people, or in this case, patients. We use the term patients, although people may be the better term, with autoimmune rheumatic disease. They utilized the information from the RecMap, from the original recommendation, adapted it, because obviously in the early trials in particular, these type of patients were not included. So an adaptation was required of whether or not the recommendations apply in the same way. And then that's the whole goal. These recommendations were contributed back to the map as adapted recommendations from the CRA in this particular context. I want to give you another little teaser here. Again, you can use the chat if you have any questions. One other big topic for us has become that recommendations were really difficult to understand. And there's a question in the chat. I can answer that very quickly. It's really all of them. So we are trying to make information available to all types of target users. And so the map is used by public health and government officials. Researchers can find information here if you consider yourself a researcher in a development effort. And we are reaching out to clinicians. We are starting a project of integrating this information in electronic medical records. But one thing that we have learned, and this directly relates to the question, because there's another target group, and that is actually the public. What we've learned is that our recommendations, in particular in the pandemic, are not created in a way that normal people would understand them. And there's a few people in our group, Kevin Potty, Rana Sharit, and Ashley Motley, together with the big executives that I mentioned, that have an interest in developing what we call plain language recommendations. So this is a bit of a new concept, although it is based on the GIN public toolkit to format recommendations in a way that the public can understand them. There's work by Nancy Santesa that was recently published based on focus groups in terms of how they would like to see recommendations. But we've started an effort to develop plain language recommendations of over 30 for key prioritized topics, with information that is more personalized. And the findings from that research suggested that people want to see the strength of the recommendation, whether or not it's credible. And there were lots of requests about formatting. So plain language recommendations are easy to read summaries of published and quality checked recommendations in our case. They produce balanced statements that include an explanation of the recommendation, so what it actually means to the public. And they are derived from the leading guideline organizations and include also link to the underlying recommendation. And so we've started translation efforts, but this will be discussed in much more detail in a forthcoming webinar to really understand what we're doing with these plain language recommendations, and also supported by the Canadian government is actually doing a trial on how to do this plain language work in an appropriate way. So in summary, what we have produced is the eCOVID-19 Living Recommendations map standing for really providing a catalog of all recommendations on this topic. We provide decision makers and other stakeholders, including the public, with this easy to navigate, living and freely accessible electronic platform that includes all available trustworthy COVID-19 recommendations. And I particularly say the public, we know that we target the public, although we are not doing the best job yet in translating it as guideline developers. We know that we are targeting the public because from the stats about visiting the website, we know that many younger age groups are actually looking into this, who clearly are not health professionals, or if at all, there are aspiring health professionals. The age group is really quite young, and we will talk about this more in the plain language recommendation presentation, the work that we are now doing with younger age groups in order to understand recommendations that can then be generalized to other recommendation development efforts. As I said, so the plain language recommendation versions are clearly needed. We do a randomized trial, and we're looking at a randomized trial in 3 population groups: adolescents, parents and caregivers, and the general public, to explore this presentation in plain language recommendations further and optimize it. And then finally, so I wanted to thank, first of all, you for listening today, but I cannot say it enough. I know that some of our key collaborators are on here. I don't list everybody by name. It's on the website. Everybody is listed on the website, but as I said, I see some of our key collaborators, a few key collaborators are here amongst the participants, and it's really, I'm enormously grateful for all of the work that has been done. Here are our contacts, primarily through Twitter. Obviously, if you want to collaborate on it, this is the email address that I suggest. Tamara has been an incredible force behind all of this work. So yeah, we have some time for questions now. From the group, I see quite a few things in the chat, and you can use the chat. Yeah, so we have another poll question that I will do in just a second. I just wanted to see if there are any questions for discussion before I pose my last question. Nothing yet. Okay, you can definitely speak up, but I have a little bit of a question of understanding. Obviously, all of this is anonymous, but it tells me a little bit about how clear I was, and possibly how much attention you paid during this presentation, and that's always both a bit of fun, but also just helping us to understand about the length of the webinar and so on. So question is, what is an additional guidance on the RecMap? A best practice advice, a very weak recommendation, a recommendation based on very low certainty evidence, or a recommendation that has no documented formal process for its development, for instance, no clear link to a systematic review? And I see a lot of answers coming in. We have 48 people on the actual webinar, and obviously we hope that this is useful for everybody. We'll end definitely on time. especially if there are no further questions. The contact information is definitely there. People are still responding. Yeah, okay. I will end it here and share the results for those of you who participated. Many of you did indeed. I will end the poll and share the results now so you can see that here. Interesting, and this question was not very tricky, but also possibly does not necessarily have only one answer, but most of you answered how I would have answered this, and that is, it is a recommendation that has no documented formal process for its development. For instance, no clear link to a systematic review on the RecMap. Again, I refer you to the paper that Tamara first authored on the actual taxonomy. So that is probably the right answer. It is true that this recommendation, if you were to do it formally, such a recommendation would typically be based on very low certainty evidence, but it doesn't have a formal assessment. If you look at the third option, nobody picked a very weak recommendation, so very good. And then a best practice advice. That's an interesting answer. So it doesn't fulfill the criteria for a formal good practice statement. But obviously, when groups offer an informal recommendation, they often believe that it is necessary and that they need to tell people what best practice is. The problem is that on our classification, the additional guidance does not fulfill criteria for a best practice statement, which are quite clearly described by the Great Working Group and in other work. So I really wanted to thank everybody. I see a few more things in the chat. It's been great talking to you today, although I always think the webinars, we need much more cameras so that I can see everybody around the table, but that's not currently permitted with the platform. So I hope you had fun with this presentation, and we'll be, I'm sure, in touch soon. Look out for the announcements about the next webinars. You can actually see that if you go to the to our website. So if you go here, you can actually you get an alert to the upcoming webinars, and you can just go there and get that information from the actual website. So if you go there, this is session 1. There will be session 2, how to support clinical and policy decision makers, development by Miroslav and team, and then we have information on the plain language versions. So great. This is the end of our webinar. Thanks, everybody. Have a wonderful weekend. Thank you, Joseph. I see that there are several people in one room. Yeah, thanks everybody. Thanks really for all the hard work to the whole team. Bye, everybody.